You ready? So I'm Wade Miller, got my Liberty badge. As you can see right there, we're going to do the head-to-toe assessment for advanced health assessment. This is my proctor.
Jessica Peluso, I'm an FNP and work as a clinical nurse educator in our MICN department.
Awesome. Okay, cool. So we're going to stand up first. And then, so introduce myself. Hey, I'm Wade. I'm going to be your nurse today. So you can introduce yourself, talking to you. We'll just ask you your orientation questions. So, you know,
Stephanie, I'm HM3 requirement.
right, awesome. And then so we'll do the, you know, person, place, time, date, setting, situation, all that. Talking to him, he's oriented, so we're not going to go through all that, but he's alert and oriented times four. And then we're going to move into the muscular skeletal part because you're already standing. So what we're going to do first is we're going to assess your range of motion and your muscle strength of your neck. Okay. So what I want you to do is just move your head forward and backwards for me. Awesome. And then if you can go side to side. Great. Great. And then what I'm going to have you do is push up against my hand here. Awesome. Come back for me. Great. And then if you could push up to this hand, push towards it. Great. Push that way. Awesome. Yeah, you're good. Just push against it. There you go. Great. So he's got equal strength in his neck and facial movements and range of motion. And then so what I'm going to do is shrug your shoulders for me. So shrug your shoulders up and try and resist me pushing down. Awesome. Good job. Okay. And then what I'm going to have you do is I'm going to assess, you can pull your hands out of your pocket. I'm going to assess your range of motion of your shoulders, okay? So we're going to have you take your arms and see if you can reach behind your back.
Both?
Yeah, we'll do one at a time. But yeah, just reach behind your back. Yep. Awesome, great. And then you do your other one. Great. And then what I'm going to have to do is raise your arms out to the side. Great. And then I'm going to try and resist me pushing down on them, okay? Awesome. Good. You can put your arms down. We'll have you put your arms out forward. Great. So we'll have you push down or resist me pushing down on them. Good job. Okay. And then while we're here, I'm just going to assess your elbow and your hands. So looking at the joints of the fingers, everything looks pretty good right now. If you want to extend and pronate and supinate your hands, twist them like this. Great. So good range of motion there. If you want to spread your fingers out wide, awesome. Then I'm going to try and resist me. There you go. Good job. Great. So he's got a good range of motion in his hands. You want to squeeze for me? Squeeze my fingers. Great. So good strength in his hands. Just relax. There you go. So what I'm going to do is test the range of motion in the elbows. Awesome. Great. And then do the other one. So what I'm going to do is pull your biceps up, and we're going to test your bicep strength. So I'm going to pull your hands in and try to resist, okay?
Oh.
Yeah, you're good. Awesome, great. And then so now what you do is test your triceps and push down on my hands. You do triceps. Great. All right, so good equal strength there. Since we're already here, we'll just go ahead and assess the fingernails. So what we got is no clubbing of the fingernails, no cyanosis, skin color is normal, no abnormalities of the fingernail beds. They're attached clean and neat. Yeah. So fingernails look good. Good job. So what we're going to do is I'll have you step forward, and then I want you to bend down. We're going to do your spinal assessment. So first, I'm just going to palpate his vertebrae. Awesome. So no abnormalities there. And I'm going to have you bend down, touch your toes. Look for the spinal alignment. Everything looks good. Come back up for me. Great. And then we'll just assess your gait. So just do a heel to toe walk like this. Just walk to the camera and then you can walk back. Walk back normally when you're done. Great. And come back. So he's got got a fairly normal gait. And then we'll do the Rosenberg. So just let you stand there and then close your eyes and put your feet together. Awesome. Close your eyes for me. Great. Lift one leg up. See if you can balance. Awesome. Yeah. Okay. So he's got the normal reflex there. Good. All right. Great. Let's see. Yeah. So what we'll have you do now is actually, go ahead and lay down. Actually, just sit on the edge of your bed for me. And then since we're already here, so I always forget this, we'll have you do the rapid motion or hand movement test. So we'll just have you flip your hands back and forth like that. Great. Good job. Awesome. And then we'll have you lay down. We'll assess your hips. All right, so what I want you to do, assess is hip strength. So go ahead and try and lift your hips up. Awesome, great. Relax, and then we're gonna assess the range of motion and the adduction and abduction. So I'm gonna take your leg, we're gonna bend it up. Great. And we're gonna move it in, and then we're gonna bring it out. Great. No clicking or anything like that. No. We're gonna take this leg. Move it out. Twist, loosen up. There you go. Bring it out. And then you can come sit on the edge of the bed for me. We'll assess his knee joints. Awesome. So no inflammation or anything like that. We're gonna have you try and lift your leg up. Lift your legs up. And go against it. Lift them up and go against my. Yep. Go against my hands. Great. And then try and pull up with your hamstrings. So assessing the hamstrings and the quad strength there. And then we're just gonna do the range of motion of the knees and just relax. Very good.
Better, probably.
Awesome. And then if he didn't have his shoes on, then you're gonna take his shoes off. Great. Good job. So we'll just assess the range of motion of his ankles as well. So that's it. So we'll have you go ahead and lift your ankles up, move your ankles down, do it in a circle for me. Awesome. Then try and push up against my hands. Great. Push down. Great. Okay.
Trying to do it.
Yeah, like pushes me. Okay. Cool. And then we'll come back to your reflexes at the end. All that jazz. Trying to think. I think we're good there. So what we'll do now is do your skin assessment. Okay, so I'm just going to assess his upper extremity skin. So the texture of his skin is normal. It's not scaly or flaky. It's moist, kind of. It's a little sweaty, and it's warm to touch. His hair is evenly distributed. The color is normal for his coloration. Not anything crazy. I don't see any lesions or any freckles. So I wouldn't be able to note any size, shape, or colors or abnormalities. They look good. And then we'll go ahead and assess his lower extremities. Coming down, I'm looking for edema, which I don't see any. I'm looking for any vascular abnormalities, no spider veins or anything crazy like that. His skin is same texture, not scaly, nothing crazy going on. It's moist and warm to the touch. And his hair is evenly distributed throughout his legs, so no abnormalities there. Then we'll move into the head to toe part of the assessment. So what I'm gonna have you do, just relax. I'm just gonna feel around on your head, so I don't notice any deformities. It's symmetrical, evenly shaped. Noticing his hair, no dandruff. The hair follicles are normal texture, evenly distributed. Moving down, we'll assess his sinuses above his forehead here, and we'll move down under the occipital, starting the nothing doesn't bother you. Great, great. So ears are evenly distributed. His eyebrows are, the hair distribution's normal. Same with his eyelashes. Everything's pretty symmetrical. His nose is midline, no deviation. If you want to close one nostril with your finger, you can breathe. You can do the other one. Be able to breathe out of both nostrils. Great. So no drainage noted. Since I'm here, I can turn on my light, and then I would just gonna have you lean back. I'm just gonna got a clean probe guard on there. Take a look up underneath. Look at each nair. Looks normal septum. And then we'll have them. We'll get a alcohol swab. There you go. Can't really smell gauze. But we'll have you sniff that. You smell that? Yep. Awesome. So that's his olfactory nerve. What I'm gonna have you do is just go ahead and smile for me. Great. So this is assessing 5 and 7 of the cranial nerves. So he's gonna smile, open his jaw. Great. Puff your cheeks out. Awesome. You can blink your eyes. And yeah. So move down, assessing the TMJ. No preface or any clicking. Open your mouth up for me. Open your mouth. There you go. Yep. So you can close it. Looking at the mastoid muscle area there. Everything appears normal. And his trigonometry as well as 5 and the 7. Opens his mouth. Says ah. Everything looks good, is intact. We'll go ahead into the look at his eyes. So we'll assess 3, 4, and 6 with the 3, 4, and 6 with his ocular movement. So we'll get our pen light first. We'll just go ahead and look at his eyes. We notice that his cornea, his iris, all his eyelids, sclera, conjunctiva, lacrimal ducts. We'll go ahead and palpate his lacrimal ducts. No inflammation or swelling. Any issues? If we had the Snellen's chart, we do the distance test. We had the Rosenbaum, we do the close vision test. What we can do is do the eye accommodation. So I'm going to close one eye, keep your eyes open. I'm going to cover one eye, okay? And then we're going to look at these pupils, and they should react. Great. So we'll do the eye cover test, and then we'll assess with the pen light, looking at his pupils. He's got perla, and then we'll assess his 3, 4, and 6 with the range of motion. So just follow the tip of the pen for me, okay? And then, right, so it's got accommodation. And then uncomfortable part, we'll go ahead and look inside your eye. So we observe the outside, turn it on, and then we'll, what I'm going to do is, tell me if I get too close to you or make you uncomfortable, but we'll look inside, we'll look at the optic disc, we'll look at the clarity, the lens shape, size, color, we'll visualize the vessels, look for the red light reflex, AV ratio, the macula and the fovea, I think, in each eye, and everything appears normal. Great. And then since we already got this bad boy out, I'm just gonna look in your ears, okay there, Stucky? Awesome. So assess his ears, looking at the auricles, the mastoid area looks, no drainage, nothing inflamed. We'll go inside. You don't want to tell me anything uncomfortable or tenderness. Looking at the tympanic membrane, the conal light reflex, it's not inflamed. We're looking at the umbo, I think, the malleus, the pars tinea, and the pars lucidea, and it's all visualized, looks good. Going around to the other side, same thing. Great. All right. You look good. No difficulties hearing or anything like that?
No difficulties.
Awesome. Good job. So now what we'll do is have you open up your mouth. Great. So we'll have you stick out your tongue. It's at 12 for the hypoglossal. Move your tongue left and right. So I think it's the Wharton's and the Snellen's glands in the back of the tongue. So if I had a piece of paper, I could move his tongue to the side, move it to this side. Great. And that side. Awesome. And then stick your tongue out, say ah for me. Let me actually. Oops, sorry. Nobody likes the taste of these, but you'll get a lollipop afterwards. Say ah.
Ah.
Alright, so push down, look at the uvula. So that's, we're looking at the hypoglossal, which is, and the pharyngeal 9 and 10 cranial nerves. So when you say ah, his uvula responds and bounces up, and he doesn't have any redness or inflammation, no nodes or anything backing his tonsils. Everything looks evenly spaced. You're probably going to say 1, if I had to guess. Looking at his gums, everything looks pink, no bleeding, teeth are intact, has a couple filled caries, and his frenulum, or the part underneath his tongue, is attached, and your lips are not cracked, and they look moist. Looks like you used chapstick, so no issue swallowing or no. Good. Great. Like to hear that. Cool. So now we'll move down since we assessed your neck. Go ahead and assess your neck here for me. We've already assessed the shoulders, the range of motion of the shoulders. So the that's 11. Yeah. So we'll assess the occipital lymph nodes and the cervical chain, and then we'll assess the auricular nodes, and then we'll come under and do the mandibular, sublingual, and submandibular nodes. Move down during the anterior chain. Oops, sorry about that. And he's got equal range of motion for his neck. We already assessed the strength by pushing on our hands. Trachea looks midline. Swallow for me. Awesome. So we can see, we can palpate the thyroid gland. It doesn't appear like he has a goiter or anything like that. It moves up and down with swallowing. Doesn't seem like it's inhibiting anything. Good job. And then I think that's everything in the neck region. Probably not. But great. So what we'll have you do now, Mr. Stuckey, is go ahead and lay down. Actually, false. Stay back up here. Sorry about that, buddy. Since you're up here already, we'll go back. Forgot to test your hearing. It's probably why you're looking at me so weird. You couldn't hear me. But so we'll do the use the tuning fork, and we'll do the Weber and Rhine test. So I'm gonna bounce or hit it here, and then you just tell me where you, if the left, right, middle, right here, middle. All right, great. And then we're gonna do the Rhines, which is we're looking for 2-to-1 ratio here. So air conduction. Which one did you hear longer? The first one. Great. So the air conduction, we're moving on the same side. Awesome. So did the since we're here and I already have it in my hand, we'll do the vibration test. So we'll vibrate it, see if he's got, you feel that? Feel well? Alright, great. Good. Awesome. Cool. Yeah, so since he's already up, we'll go ahead and look, listen, and feel his upper chest area here. What we're going to have you do is just breathe normally. It looks like he's got a symmetrical chest. No labor breathing or anything like that. What we can do is take a listen to his back. So I'll come around the other side. While I'm up here, I can probably listen to his carotids. Bell there, so. Yeah, I see about sped. Sure, probably forgot the neck region. And no grills or worries in there. We'll listen to his lungs, so take a deep breath for me. Awesome, so he sounds clear throughout. And then what we can do is we can percuss for resonance and find his diaphragmatic excursion. So probably right there, get the dullness. So take a deep breath in for me. And exhale. Deep breath in. Okay, great. So he's got resonance aroused, dullness around the diaphragmatic region. Feeling around, doesn't have any subcutaneous emphysema, which is really cool. But you don't have it, so that's good. And then, yeah, covers the lungs and the thorax area. So what we'll have you do is probably just lay down now. Thanks, buddy. And then we'll look at the chest. I don't see any craziness going on with the heart palpitations or anything crazy movement going on. I'm feeling, and I can feel his apical pulse. I don't feel anything weird. Like I said, no equal chest rise and fall. So we'll listen to the aortic, the pulmonic, Eric's point, tricuspid, and the apical areas of the heart. And then we'll flip it over, listen with the bell for the murmurs. Don't hear any murmurs, gallops, or anything. And then if he was standing or sitting up, we could have you lean forward and listen with the bell. Listen to your mitral area, see if we hear any mitral abnormalities. And then since we're in the cardiovascular area, we'll go ahead and assess your brachial pulses, which are good. Do your radial pulses, which are awesome. Do your popliteal. Great. And then we'll do the tibial and your pedal pulses. And luckily for you, everything's flowing well, so good job. And then I don't notice any vascular abnormalities or hemostasis or anything like that. So what I can do is inspect extension of the abdomen, no wounds or anything like that. We'll go ahead and listen.
I use hand soap.
Pounding around.
I wash them when I get home again, and I'm just...
His bowel sounds are active throughout. We'll listen to his for abdominal bruits, and we'll listen to his for febrile bruits and frills. But he does not have any, and we're going to exclude the genital exam unless you want to continue with that. Okay, great. That's what I thought. So we'll go ahead and palpate around. The textbook wants us to save the most tender spot for last, and don't feel any pain or any abnormalities there. So what we're going to do is we can percuss the liver. And then we can try and palpate the liver's edge there. Great, and then we'll just have you roll, just lay right there. We'll palpate the spleen. And then we'll have you roll over on your right side, and we'll go ahead and palpate the spleen. Great, hopefully it's not too uncomfortable for you. Alright, good job. Roll back over. Then we can palpate the kidneys. Probably not going to feel them, and they're not too inflamed, and they're not really bothering them. And we can, I suppose, percuss them if you got over on his back. But he doesn't have any issues there. I think that's good with your abdominal exam, but I'm not sure. And then, so rounding up the whole story, I think we'll just finish off your neuro assessment. So why don't you hop up on the side of the bed for me? Yeah, just finish. So we'll assess his reflexes. So do his elbow here, just relax for me. This one's always kind of hard to get. There it goes. Do this one. There it goes. Great. And then we'll do your brachial radialis, or however you say that. I'll put my thumb there, and I'm going to crack your bone for the workout. And so on and so forth. Just relax. One's always hard to do. And we'll do your knee. Great. You're very hyper at it. Awesome. Do this one back here, relax. Okay, great. And then, so what we'll do, we can do assess your facial sensitivity. So see if you feel that. Just let me know. Right, and then we can do, just tell me if it's sharp or dull, okay? Sharp. Yes. Dull. Okay, great. And then, so what we can do, we can assess that down here too. Yeah, sorry, that probably tickles. Awesome, so feel that full sensation down there? Yeah, great. And then we can assess his upper extremities to see if he has sensation. You feel all that. This stereostenosis, I think is what it's called. We can do the, we'll give you this, or I'll tell you what it is, but close your eyes, put that in your hand, tell me what it is or what it feels like.
That's the guns.
Great. And then we'll do the other hand. Awesome. What does it feel like? Guns. Great. And then we'll do the gravia, where we're going to write in his hand, and you just tell me what number I'm writing, okay? since we forgot the whisper test, I'm gonna whisper a number in your ear. You just tell me what it is, okay?
7.
8.
8.
Not really a whisper, that would be close. And then we already did the rapid session, and then yeah, the point of position tests, which you're kind of blanking on, but I'm gonna take a shot in the dark and just I think it's like this. Close your eyes and you just which way's up? Yeah, okay. I have to research that one a little bit. But can you think of anything I missed? Because I can't. Yeah, so I think that might conclude everything. But I'm not always sure, so good job, Stephanie. I think that wraps it up. Yay, me.